Welcome back. Now, physiotherapy is a medical specialty that helps to restore movement and function when somebody is affected by injury, illness, or disability. It can also help to reduce your risk of injury or illness in the future. To educate us a bit further is physiotherapist Xhandra Smit. Xhandra, good evening and thank you so much for joining us here on the Daily Roundup.
Good evening, Nina. Thank you for having me.
Xhandra, I understand that there are quite a few different types of physiotherapy. Name three of them and tell us a bit more about them.
Okay. Yeah, it's not types of physiotherapy. It's just things that physiotherapists do. Mm-hmm. Okay, so let's cover orthopedics. It's when you're broken bones or any pains and, posture and such. Then, say, neurological would be cerebral palsy kids or after a stroke or a head injury, which is, of course, much more complicated. And I do believe that you need some expertise in that or, experience, let's say, rather. Then another one, sports physiotherapy. That's dealing hands-on with sports people on field or just off field. Is that enough? There's lung physiotherapy that you do the lungs, even in ICU. Many more.
And what do you specialize in?
I like pain, so say orthopedics. I like to figure out pain. That would now include any pain, headaches, anything. We're also trained to diagnose, so we can diagnose whether a pain is a mechanical pain or if it's more medical issue that needs to refer back to the doctor.
Mm-hmm. Talk to us, Xhandra, about how physiotherapy helps to restore movement after an injury. And do you use the same approach if you're working with a patient that needs neurological help?
No, neurological is much more complicated. You need to create new pathways in the brain. So that's an ongoing supportive. It's much more complicated. A physical injuries, all injuries heal with scar tissue. And I would say it is about controlling the scar tissue. You need the scar tissue, but you need it in a controlled form. And then, of course, that's where the movement comes in. So if a person moves right, then the scarring will organize itself right, and then you will have normal movement afterwards.
Mm-hmm. Xhandra, is physiotherapy safe for children and small babies? And what would they typically need physio for other than, a physical injury?
Babies and small kids, it's a bit more complicated because they don't have the wear and tear that older people have. So they have different kinds of problems. And usually, in a lot of cases, it's more medical issues where and there are growth plates involved. So it's more complicated in that sense that you cannot just, you have to know whether to do weight bearing or whether to immobilize the kid or, that's as far as orthopedics go. Then cerebral palsy, of course, babies with delayed developmental developmental stages, and lungs, small babies. We do even the premature babies. You do the lungs. It's very, very effective and it helps them a lot.
What's the difference between a physiotherapist and a biokineticist, Xhandra?
Biokinetics are more exercise. They heal by exercise. So I would. There's a lot of confusion there. I'm happy you asked that question because a lot of doctors feel that they just send the patient directly to the biokinetics. But if the patient can't move right, of course the biokinetic is just going to make it worse. So in a lot of cases, 80% of the cases, it's better that they come to us first to sort the movement problem out, and then they can, and posture. So we have to fix the obstacles for posture, and then they go to the biokinetic. If they understand their posture, they go to the biokinetic and they then strengthen the posture. Yeah, so of course we can do we can give the exercises, but if the patient will do it is a whole different question. So it's much easier for them and much more motivating to go to biokineticists, and they, there's a lot of people exercising there, and they, it's a much better situation than for them to go regularly.
Xhandra, thank you for educating us this evening. That's all the time we have. Thank you so much for joining us.
Thank you. Good night.
That was physiotherapist Xhandra.